So today we will discuss about the evolution of sepsis definition over time. So in the beginning, in the year of 1991, the two of the giant society of critical care medicine and American College of Chest Physicians, they came together in UK and they defined the definition of sepsis for all of us. How they defined it? SARS plus infection. SARS is what? Systemic inflammatory response syndrome, right? It has four criteria. Number one is temperature in centigrade. It can be more than 38 degrees centigrade or less than 36 degrees centigrade. Second is TLC or WBC count, can be more than 12,000 or less than 4,000 or more than 10% band cells. Respiratory rate more than 22 or PaCO2 less than 32. Heart rate more than 90. So any two criteria is positive, patient is called SARS positive. Right? So if a patient is SARS positive and they have a source of infection, they classified it as sepsis. And SARS plus infection plus organ dysfunction, this is severe sepsis. SARS, infection, organ dysfunction plus, so here the organ dysfunction, they defined it as hypotension and symptoms related to hypoperfusion. That is increased lactate, organ dysfunction like oliguria, AMS, respiratory failure, etc. etc. When the organ dysfunction or the hypertension is fluid refractory, at that time they called it septic shock. This is how they define sepsis, severe sepsis, septic shock. As we come from surge to infection to organ dysfunction to fluid refractory hypertension, the severity of the disease increases step by step. Right. Now let us go in depth into the concept of this sepsis 1 definition and find out the pitfalls or the problems, and based on that we'll decide what could be our sepsis 3 definition. Right. So first coming to SIRS. So the SIRS is very non-specific. Why? Because it is a inflammatory one. Inflammation can be two types. One is sterile inflammation, another is non-sterile. The non-sterile inflammation is called infection, right? And this they called SIRS with infection. It is sepsis, right? And the sterile source of increase in SIRS: burn, trauma, we have pancreatitis, we have ischemic reperfusion, and post-cardiac surgery patients. So these are the sterile inflammation which has caused the surge to increase. Now, as time has progressed, now we know that sepsis is the immunopathic condition. Immune dysregulation is there. So in some patients, the immunity may be flared up, hyperinflammatory. In some patients, it can be hypoinflammatory. So the sepsis here can be hyperinflammatory or it can be hypoinflammatory. When the hyperinflammatory, the surge will come positive. Hypoinflammatory, surge will come negative. That means the body's immunity is so paralyzed that cannot mount a immune response against the infection or inflammation, right? So you see, regarding the surge, there is so much uncertainty. For example, surge is positive, can be sepsis. For example, non-sterile inflammation, infection, sepsis is there. Or if surge is positive, sepsis may not be there. Where we've seen surge positive, but they born trauma, pancreatitis, ischemic reperfusion injury, post-cardiac surgery. In those patients, sepsis is not there, but surge is positive. Again, SARS can be negative but still sepsis can be plus. Here you see SARS negative, but the patient's immunity is so paralyzed that they are not able to mount a inflammatory response to sepsis. So SARS will be negative, but sepsis will be there. Examples are in this situation: old age, patients were taking beta blocker, immunocompromised. You see how much uncertainty is there if we put SARS at the diagnostic criteria for diagnosing sepsis, right? So then what is actually SARS? It is a response to infection. This response is normal response, a regulated response or usual response. For example, if I have an infection, I am sitting at home, I have a chest infection or a urinary tract infection, I will have fever, I will have increase in WBC count, I may have increase in respiratory rate or heart rate. That means I am SARS positive, but that does not mean that I am septic. No, it's a normal or regulated response to infection. SARS is not equal to sepsis. SARS plus infection is not equal to sepsis. This means SARS or SARS plus infection, they are infection only. So this SARS plus infection sepsis, this is not the exact definition of sepsis. When I am having a chest infection, I am tachycardic, I should not call myself that I am in sepsis. No, I am simply infected and it can get easily cured. Sepsis means there is organ dysfunction. So normally when I get infected, I take medicine, I get cured. But if I have a chest infection and my kidney goes down, I became completely anuric. That is something unusual. With my existing infection, my other organ systems are also failing. This is not normal. So this is called sepsis. So sepsis means organ dysfunction has to be there. Without organ dysfunction, sepsis has no meaning. Organ dysfunction, it defines sepsis. Not SARS, not infection. So to classify SARS and infection to sepsis is actually making mockery of the severity of the sepsis. Because SARS plus infection is equal to infection, it gets cured very easily. It's not sepsis. If you see according to the modern data, when a patient is diagnosed with sepsis, according to sepsis 3 definition, the mortality increases to 10%. Or according to old definition, this will be severe sepsis. And when the severe sepsis goes to septic shock, the mortality increases to 40%. So we are dealing with very, very severe life-threatening thing that is called sepsis. And to equalize sepsis with surplus infection is actually a mockery of the severity of the sepsis. That we should avoid. That's why it is completely abandoned right now. Right now, sepsis means organ dysfunction. So regarding organ dysfunction, what is the sepsis 1 definition says, we will discuss now. So in sepsis 1, this organ dysfunction, clear cut concepts. Only they use clinical symptoms. For example, patient is altered, patient has decreased urine output, decreased platelet, increased bilirubin. Even in each organ system, there is no gradation. Overall, there is no categorization. So using these things, you cannot prognosticate or cannot predict disease. So we need a scoring system for that. So they did not use any scoring system. What happened because of that? The diagnosis of sepsis is delayed. Delayed means mortality increases. If the patient goes to shock, mortality increases to 40%. So this is the pitfall of the sepsis 1 definition. So in the very beginning, the first problem is if you equate SARS and infection with sepsis, then every patient who is having a fever, tachycardia, high respiratory rate, you classify them as sepsis, you give broad spectrum antibiotic, you give fluid, but actually this can be simple infection which did not require hospital admission also, which did not require broad spectrum antibiotic also, which did not require fluid resuscitation also. So this is overdiagnosis, and this is wrong. SARS plus infection is not such it is simple infection and cured easily. When organ dysfunction is there, at that time this is actually sepsis, because in normal infection organ dysfunction does not occur. In sepsis, organ dysfunction occurs. So organ dysfunction is something that defines sepsis. But the same organ dysfunction has been defined in a very vague way in sepsis 1 definition. What we get from sepsis 1? Number one point is search is not required now because it is so non-specific, it is so variable, it is found commonly in many type of diseases. You just cannot use it to diagnose sepsis. So search is gone. Second point is organ dysfunction is the defining feature. This you have to remember. Now onwards, we will use OD in case of organ dysfunction. It's very, very important. It is so important. OD has to be there in the definition. It's not the case in case of sepsis 1. Number 4, it is so important that we have to diagnose it early. So we need scoring systems, and we have two scoring systems in sepsis 3. One is called qSOFA, and another is called SOFA. What is qSOFA? What is SOFA? So SOFA, sequential organ failure assessment or sepsis related organ failure assessment. So this uses 5 systems: renal, CVS, CNS, respiratory, and POA. Each system has been graded into different dysfunction score. Where the maximum score is maximum dysfunction, and there is a cumulative score also. So the score ranges from 1 to 24. 24 is being the worst, and it is measured once a day. The patient have a delta SOFA more than 2, organ dysfunction is positive. It's a diagnostic tool. When it is present, SOFA score more than 2, mortality increases by 10%. Right? Then we have qSOFA. qSOFA is something that is, this is for ICU population, the SOFA. qSOFA is for ER or ward. This is made for early identification of not sepsis, high risk patient who can develop sepsis. So that's why once your qSOFA is positive, you go to then SOFA directly and search for infection. qSOFA is BP less than 90, respiratory rate more than 22, and GCS is less than 40. Any two positive is considered qSOFA positive. So qSOFA is positive here. If qSOFA is positive, this is a warning. This gives you warning that this patient will become bad in the hospital. So when qSOFA positive, that means there is 4 to 14-fold increase in mortality of the patient. So this is very, very important. Mostly for the year and what to early identify patient at risk. Once at risk, you find out SOFA, you find out the source of infection, you treat the patient in an emergency basis. Like so, the organ dysfunction is so important. For example, if you find infection in a patient, immediately you search for organ dysfunction. If it is present, then that classified as sepsis. Contrary-wise, if organ dysfunction is there, then you search for infection, and that can also be sepsis. Both are true. If a patient is having infection and you are giving round to the patient and you saw in the labs there are some organ dysfunction present, SOFA score is more than 2 over the last day, then patient is having sepsis. Contrary-wise, if you are giving round to your patient and there is no fever, nothing, but you see the organ dysfunction, creatinine has increased, thrombocytopenia is there, bilirubin is increased, oxygen requirement is increased, so there is organ dysfunction, then immediately it should struck to your mind that I must find out whether any infection is there or not, whether the patient is septic or not, right? So it works both the way. And based on these findings, the sepsis 3 definition now we can check out. How? Let's see. And another thing, because see, we are dealing with something very, very serious. So organ dysfunction, when present, the definition should be clear and loud. We are dealing with thing that can cause death. Definition should be very, very clear. Otherwise, we will be very casual. For example, in the sepsis one, SARS plus infection is sepsis, and organ dysfunction is severe sepsis. So when the patient, somebody diagnosed sepsis, they are very casual. Okay, patient is having sepsis, but it's not severe. We'll wait till the patient goes to severe sepsis. No. So the sepsis by itself is severe. That you have to understand. Sepsis by definition is severe. That means the definition should contain something that triggers us that we are dealing with something very, very serious. We have to be proactive. We have to deal the patient very, very urgently. Right? Now coming to definition of sepsis 3, the first and primary thing is we are dealing with a life-threatening thing. Why life-threatening? Because once you diagnose sepsis, mortality increases by 10%. Once sepsis progresses to septic shock, mortality increases to 50%. Then second is organ dysfunction. And this organ dysfunction has to be quantified, clearly defined. How it is defined clearly? Using SOFA scoring system. And in the word and year it is qSOFA. So we have a system where we can quantify the organ dysfunction, we can diagnose it early by daily measuring it. This is very, very important. So life-threatening organ dysfunction caused by dysregulated host response to infection. This dysregulated host response is the organ dysfunction, because the regulated host response is SARS. SARS is regulated, normal, and infection is the core of our sepsis definition. It has to be there, right? So this is the new definition. Everything is there in the definition. So the nature of the definition is such that it immediately disregards SARS. Plus, sepsis by definition is severe, life-threatening. So there is no concept of severe sepsis. This is also abandoned. So in the sepsis 1 definition, it was SARS plus infection, organ dysfunction, that was classified as severe sepsis. But now, and this is classified as sepsis. But now, sepsis in definition itself contains organ dysfunction. This is there in the definition. So there is no place for severe sepsis in sepsis 3 definition. Because sepsis is so non-specific, it is also not there. So now infection plus organ dysfunction is sepsis. And it is life-threatening. Once you diagnose sepsis, your mortality increases by 10%, septic shock 40%. Right? So this is the new definition. Life-threatening. From the very beginning of the definition, it is telling you are dealing with something very, very severe, very, very life-threatening. It can kill the patient. So be very proactive and diagnose it quickly and start the management. Organ dysfunction is the core of the sepsis definition. So organ dysfunction now is not a vague term. It is classified, quantified by scoring system, SOFA scoring system for the ICU, qSOFA for the ward or the year. So this is the definition of sepsis according to sepsis 3 definition. Right? So now we can just have an algorithm. Patient is in ICU or ward or ER. In the ICU, patient has an infection plus delta SOFA is more than equal to 2. SOFA can come fast, then you found infection, or fast you found infection, then you found SOFA more than 2. Any which it can be possible. So this is called sepsis. When the ward or ER will check for decrease in SBP less than 90, respiratory rate more than 22, and AMS GCS less than equal to 14. So if it is there more than equal to 2, qSOFA is positive. Here what we do two things. One is search for infection, look for organ dysfunction. Here you have to use SOFA score. If SOFA score is more than equal to 2, in patient is sepsis, start treatment according to surviving sepsis guidelines. qSOFA is positive, look for infection. If infection is there, look for organ dysfunction. If organ dysfunction is there, look for infection. In both the case, you go to the sepsis line and treat according to surviving sepsis guidelines. Right. So this is how today we define the evolution of sepsis definition over time